The baby is born hardwired. One of the few things we are hardwired to do is to relate. Babies are born exquisitely sociable, and you've only got to pick up a newborn baby to see that they seek out eye contact, and that's hardwired, and to see that they mimic facial expressions, that's hardwired. So all the fun things like sticking your tongue out or yawning or holding your hand up, the baby will respond to. Babies are hardwired to make social interaction, and that is because socialization is so important for humans. We need to be socialized in order to build the right structures in our brain that we're going to need for the rest of our life. We're not genetically set up for any particular environment, we're genetically set up to be adaptable, and what we adapt to is the first caregiving environment. We know that a lack of physical contact, if you're not careful, can cause an excess of cortisol, and that in itself will have an effect on the baby's brain, so things like baby massage are really important. In terms of feeding experiences, that's a good example because, of course, the feeding experience encapsulates a lot of a relationship. You can imagine two mothers in the same block of flats. One mother comes from a secure background, so her internal working model of caregiving is adequate, it's good enough. She can muddle along, she can get it right roughly half the time, which is better than most of us, and that's fine. Nobody has to be a perfect parent. That would be disastrous, I think. But she's feeding the baby on her left side. The baby's getting nice physical contact. The mother's relaxed, so the baby's relaxed, because of course the baby will pick up all the mother's subliminal signals. The mother's enjoying the feed. She's able to focus her attention on the task at hand and not be distracted. So she hasn't got other things on her mind, which a more stressed mother might have. She's only got the baby on her mind. Gradually gets through, finishes when he or she feels like it, and it's a complete experience with a beginning and a middle and an end. And that baby's had a good experience. And in terms of the brain wiring up, what's happened is neurons that fire together wire together. In that baby's sort of internal representation of the mother is mums, or relationships as it will be, make you feel good, they care for you, you can feel safe, you can relax. A safe and relaxed baby, attachment is switched off. You should only see attachment behaviour when a child is anxious, so you should not see attachment behaviour predominantly for most children. Attachment behaviour is only a sign of anxiety, and this baby is showing no attachment behaviour whatsoever. It's just having a comfortable feed. Now next door we could have a mother who, for whatever reason, can't keep the baby in her mind. She can't hold the baby in her head because she's overstressed and she's vulnerable. She's struggling with a multiplicity of risk factors which are impacting the relationship, and these can be social, like poverty or racial intolerance. They can be immediate, like an inability to tune into the child because of her own background or trouble with a violent partner, or they can be in her own past, such as being in care or coming from a background of maltreatment or poor parenting herself. But for whatever reason, she can't hold the baby in mind, and maybe she can't even tolerate unconsciously giving the baby a good experience because she did not have it herself. And so therefore you get the paradox of mothers sometimes being jealous of their own children because they're being asked to do something for their child that nobody did to them. And these mums, of course, need even more understanding and support. They certainly don't need blaming. And perhaps it's important to just do an aside here and say there's no such thing as a bad parent. All parents do the best for their babies that they possibly can. No parent sets out to be a bad parent or a difficult parent, but all parents bring different resources. And there's, all of us who've been a parent know there's nothing more stressful and exhausting than being a mum or a dad. But this poor mum and this poor baby are getting a completely negative experience. The baby doesn't feel settled. The baby may be being prop-fed. The mother isn't making eye contact, so there's no excitation of the right brain. The baby just is doing a mechanical task, gulping it down, is probably going to get colic. So that will make it, again, a more difficult baby to settle, which will make the baby even less satisfying from the mum. And you can see the whole thing going off into that predictable negative spiral. And yet they're both having the same experience, these two babies. They're having a feeding experience. But what's being wired up in each baby's head, the structure of their mind that's being put in there, could not be more opposite.